Well, a brilliant Thursday evening wherever you are. Hello and welcome to Tipping Point. My name is Nick Mudimba. It's a gloomy season for the health global picture, and you know what it means. The COVID-19 is wreaking havoc even to the powerful economies in the world. The US, Britain, Italy, Spain feeling the pinch. And it's something back home here in Africa we need to learn, because many people are saying our time hasn't come. But again, we rebuke those sentiments. It's clear that these are very difficult times, and you know very well from even those people who've lost their jobs, those people who've actually to face pay cuts. It's a very, very depressing season. But the global health situation is that you need to keep safe, stay at home, sanitize, wash your hands, be disciplined. Coronavirus is real and is actually taking lives. It doesn't matter the age group, doesn't matter who you are, and of course, as the president said, doesn't matter how heavy or thick your wallet is. When it comes, it's actually arrived and it has no mercy. In studio, I'm not alone. I'm joined by Dr. Jackie Nyaberi, who's of course a public health specialist and lecturer at QUARANTINE. We'll be going through so much conversations because now governments are realizing how important health workers are in our society, and they're being employed like wildfire. Right now, the nurses, the doctors are very important, finally, because we've been crying about this for a very long time. Jackie, good to see you today.
Good to see you, Nick.
Yes, it's a period, I must say, not very easy for so many people.
Right.
And someone was saying, if you see biggest economies like even the US coming to be hit hard like this, it means this is something that we can't take lightly. Just briefly, what do you think about the whole scenario right now, with the fact that now we just need to stay at home? Because now, as much as we are staying at home, there's also the effect, even psychological effect, that is hitting people big time. What do you think about all the scenario?
Thank you, Nick, once again. It's a complicated situation, and every other day things are evolving that are so new to us, and even to just hear, to just listen, to just understand what every other person is going through. And I want to echo your sentiment that coronavirus, COVID-19, is a disease or an infection that can infect every other person.
Absolutely.
And other than the health implications being felt, we are now feeling, the effect that it has as far as, the economy is concerned, as far as, the psychology of humanity is concerned, because containing a socio-human being because the motto here, we want every other person to stay at home simply because we want to ensure that people are protected and we are not infected.
Yes.
It is a scenario that is so complicated. When we are talking about business issues and several other ministries that are affected, it is a scenario that really we need to be so vigilant about and get to know what is it that we need to do, each and every person, what is the role of every other person for them to, for us to be able to do what is right.
Absolutely.
I actually realized that it's a virus that has made the entire world to come to a standstill.
And all the same people are actually equal, right?
And everybody is now equalized. I have been making a lot of observations. We have lived a life where we are so selfish. We have lived a life where I don't think of a brother, I don't think of a sister.
Sure.
It is now a scenario where it is awakening to every other person, the politicians, the government, those who are doing very well, those who are doing poorly, to realize that it comes to a time when we are talking about matters of life and death, health issues will always come first.
Absolutely.
And now it's a moment that we need to take a step back and watch and think critically, what role do I have to play, either to protect a person from getting COVID-19 or to protect myself. I am so happy that in this country now we are getting into the realm where we start, learning how important to share.
Yes.
How many times in this country would you go to a particular shop or another place and no one gives you water to wash your hands? No one gives you a sanitizer. And now, things are changing. We are being made to understand that there is the face of humanity that we need to live with a lot of reality.
Absolutely.
Yeah.
All right. Let's now talk about matters back here in the country, because now you know very well rumors coming in that 17 MPs contracted COVID-19, and many of them have actually denied. But we're now roping in Tony Buluma, who of course was supposed to be here, but due to unforeseen circumstances, he wasn't able to make it in studio. But again, the discipline is still intact in studio. You can see it's more than 1 meter. Dr. and I are actually doing well. And let's now rope in Tony Buluma, of course, who's the CEO Young Parliamentarians, via phone link. And Tony, if you can hear me, my brother, good morning, good evening. How are you doing, bro?
I'm doing great. Thank you very much, Nick. I hope you can hear me as well.
I can hear you very, very clearly. No, let's touch base about issues. Parliamentarians contracting COVID-19. This was termed as a leakage. What's really going on here, Tony?
Yeah. First of all, my apologies for not being able to make it for the interview. As you are aware, that there is a lot that is going on out here in terms of just preparing our people for prevention. And I want to point out that recently Parliament gave a communication to the effect that was inviting members of Parliament, their families, a security team, and possibly even members of the staff for mass testing within the presence of Parliament, and that was quite done. As you may be aware, and has been communicated by the Ministry of Health, that the results of this testing are fairly confidential. Because I think that the standard in terms of the doctor-patient relations and confidentiality have to be observed, so that we do not in any way jeopardize. So I have seen a list going around with names of members of Parliament, particularly 17 of them. And I want to really inform the public that that is not entirely the correct position, because as you are aware, members were sent for this information privately to the insurance, the guys who are doing the testing. But having said that, I think it would be important that, and I like what the Ministry of Health has already said, that they are now working towards doing testing and literally monitoring even the testing that is going on at the judiciary and Parliament, so as to ensure that they are up to date in terms of the information of whether they are indeed members of Parliament who've been infected. And this will really help, because you realize that members of Parliament, even amidst where the situation we are in of stay-at-home policy, a lot of them are still exposed to many members of the public who are demanding for their attention, demanding for them to attend to issues for their constituents, and it's really a very difficult thing. So I would really insist that it should be a priority even for the Ministry of Health to really follow up with the particularly memberships of these two very important institutions, the Parliament and the judiciary.
Something else, Bwana Tony, Waswahili walisema lisemwalo lipo. And you see, this is something that even Kenyans know very well. Once these talks actually come out here in public, it means there's something happening in Parliament. Now, look, there was a sitting just when this issue started actually coming into the country. You can imagine the risk that so many lawmakers took to go to Parliament on that sitting. Tests are yet to be done, but again, we're talking about 24 hours for us to know the test. But of course, the healthcare ethos, it says that privacy is very important. That's why we do not know at this point who has been infected. But look, lisemalo lipo. What do you think about this thing?
It makes a lot of sense, and I'll tell you, Nick, that all of us are potential victims of being infected. And therefore, you cannot rule it out. For as long as tests were done in Parliament, there is a possibility that there are those who may be positive, there are those who are also negative. And therefore, it's really upon the Ministry of Health to really reach out to Parliament and put all necessary measures to ensure that, because this information is available, and you can be sure that even the Parliament leadership, I'm certain, and I cannot speak for them, would be willing to share any information that would help the country in the fight against this COVID. And therefore, I cannot entirely say that I am most qualified to confirm or deny on whether indeed there are members of parliament who are positive or who have been infected by COVID. But all of us are aware that the testing has been going on in parliament for the better part of last week, and the results thereof are bound to actually generate or elicit a lot of public interest. It's only fair that in the interest of the communities that might easily be affected, that probably extra attention is given towards the results in parliament, so as to enable us to, if at all we are in such a situation, contain it at that level. Because like I said, MPs are exposed to many people. It's not like me and you who probably would sit in the comfort of our house and really avoid many people coming to see us. A lot of them that I've been talking to, even those who travel to the village, despite the warnings by government, constituents are still reaching out to their homes, knocking gates, demanding audience with the members of parliament. This one in itself is not only exposing the MP, but also exposing their potential to the risk of being of contracting COVID. So that's why I'm saying extra attention ought to actually be extended to parliament, so as we deal with that situation at this level.
Absolutely. So finally, what do you think about the movement secession in the 4 counties? Because now we're seeing drastic changes. The whole idea is to flatten the curve, Bwana Tony. So finally, briefly tell us, do you think this will work?
It won't work, but my own personal view, if I was to advise the president, I would go for government to convene parliament. We put measures to ensure that we cushion, especially the most vulnerable in our space, from being exposed to hunger. And then we entertain the idea of a 21-day lockdown, so as for us to properly contain this. Because what we've done is we've only created a station in Nairobi County, where it's one of the hotspots. So what I'm just saying is that if Nairobians have it, spread it amongst yourselves, but don't take it to other counties. So it's not really helping the situation. Because at the end of the day, we really want to deal with this for once and for all. And for us to be able to deal with it, I think it will be more objective if we close down the entire system for maybe a substantial number of days. So that we now know what exactly are we dealing with. We'll have isolated the patients, the people who are victims, and allow the others to continue with their normal life. But if further now, what we are doing is we are preparing ourselves for the worst. And the CS is on record having given that indication. And then, number 2, we must also be very careful, because there are certain constitutional issues that we are overlooking. Like, for example, a measure that includes almost the declaration of a state of emergency requires parliamentary input. So that we are very definite in terms of our timelines. If we are talking about 21 days, are we saying 21 days to be renewed under what circumstance? So that also don't get up, because there is a new conversation that is coming up, Nick, that is called the politicization of COVID-19. And it's an important discussion that the media needs to pick, because when Corona is done, are we still going to go back to our democratic culture or data? Because Corona is bound to reorganize the world order. And I would dare say it will reorganize even the national order of things.
Thank you very much, Tony Buluma, for your sentiments over there. And let's hope sanity will come back to our nation and, of course, the world as a whole. But there's something else before I let you go, Tony, because do you think it was a knee-jerk reaction by the president to just impose this secession on the 11th hour? The speech was at around 4 p.m. and the secession started at 7 p.m. People really suffered big time. What do you think about that?
I think I would actually say that it was more of a knee-jerk reaction to a certain extent, because that move was a bit more insensitive to the reality in terms of the movement of people. As you've been seeing around even social media, people have been stranded. Some people are on their way to Nairobi, and yet the orders were taking effect 7 p.m. of that night. So I think probably it would have been better if he did the same. He would have given some little time, like he did for Mombasa and Kilifi and Kwale, to allow people to make relevant adjustments. I have so many friends who are calling left, right, and center, asking because they have left their family. Somebody had gone to maybe somewhere in Loitoktok,
Yeah.
and he goes back, he got stuck along around Conva City, and he has nowhere to go. So I think even as we handle the COVID issue, it is best that it is done in a manner that also is considerate to the realities of the day. Because Kenyans are still going about fending for their families. So in the midst of this, how do we cushion them from divisions that are likely to, escalate the situation to be even worse? So, like, for example, the people who are stranded in different points where these borderlines have been affected.
Absolutely.
What happens?
Absolutely.
How do they access their families? There
All
are
right.
people who are in Nairobi who need to be transported to whatever places. But I've seen the ministry has made a bit of some adjustment, and they're saying that they reach out to the Ministry of Interior.
Okay.
They should be able to assist in terms of facilitating
All right.
this movement. But I quite say that it was a fairly ill-informed move by the president to just introduce the curfew.
Okay. Thank you very much.
Almost, and give people less than 2 hours to make adjustments.
Okay. Thank you very much, Bwana Tony, for your actually input, because now we feel like there's so much actually to talk about. And we'll come back to you again for more details, because now we need so much information. And thank you so much for the information regarding parliamentarians. But coming back to you, Daktari, from Tony's kind of words, it's clear not everyone is happy.
Right.
Not everyone is happy, because when you see families stuck and the government coming out just to impose the secession, 2 hours, 3 hours too, do you think the president's advices were wrong this time around here?
Well, I will not just talk about the president, but I will talk about the advisors of the president.
Yes.
Because behind, the president, we have people who are working and to ensure that they give the right information. They, let him know what the situation is and how to go about it.
Absolutely.
I echo the sentiments of Tony, and it is clear that it was a moment that you probably may have jeopardized the lives of many as far as the movement is concerned, given the timeline that was actually not allocated, that was sufficient for people, to be able to get from the place where they were, to their home, so on and so forth. And I am not, I'm not saying that just to, to say that, to acknowledge that really what the president did was wrong, what he did was right, but the timing was wrong.
Yes.
So that if they needed to have advised the president, they needed to have given sufficient time, probably 1 day, it's quite enough. Let us know that we are going to have secession in these counties, and therefore ensure that, you are in the place where you're going to be for the next 21 days, which is okay. But again, as if that is not enough, now that we have been given the secession, what is on the ground is actually not what is happening. We are seeing a scenario where Kenyans are getting to the border points, using the matatus, and then they just get out and they're walking the other side, and it really doesn't serve the purpose. And I want to call upon all the Kenyans at this point in time to take individual and personal responsibility, because surely when we are having such restrictions, it's not because the president, does not want our life to move on, or one or two things not to take place. All they are doing is that they are trying to be as ethical as possible to ensure that they protect the lives of Kenyans. And in a society where there are no restrictions, in a society where there are no rules and regulations, then it will turn to be something different.
Absolutely.
I would call for all Kenyans to oblige, to obey, and really there is no need for us to politicize these things. A few days ago, we were having, the impeachment that was to take place in Kirinyaga.
Yes.
And having the borderlines where we are supposed to get, where we are not supposed to, to cross over. And at that point in time, you realize still people are able to cross over, and they are going all the way to Kirinyaga, and they are coming back.
Okay.
I have even seen, as at this morning, that yesterday evening, the president now allowed that if we are having individuals or patients who are coming to Nairobi to seek medical care, then they can be brought all the way.
Absolutely.
Yeah, so we need to just look at those scenarios that can work for all of us, and ensure that we protect every other person.
So before we actually take a break, let's listen in to Mutahi Kagwe, because the point is that that secession is very important. But according to Tony, it means that Nairobians now can infect themselves and amongst themselves, because now it didn't make sense for that knee-jerk reaction. But let's listen in to what the CS had to say about the secession.
Is to ensure that we do not take the virus up country and to other counties, because Nairobi has the highest infection rate. So that's the idea. And also for those in other counties not to come into Nairobi and get infected while within. We have not stopped people from moving around within that area.
All right, that's the whole idea. Nairobians shouldn't go out there and infect other counties, vice versa. Other counties, the residents shouldn't actually come to Nairobi and get infected. That's something, again, we're going to discuss after a few. And of course, right now we're taking a short break right on Tipping Point. But you can be part of this conversation by SMSing us on 22999, and I'll be sampling some of the views as we move on the show, because now it's fast-paced, and the politicization of COVID-19 is actually very, very unfortunate, and also reports that other corporates are taking advantage to actually now release their staff, and it's something also very uncouth from such management teams. And let's hope things actually get back soon, because so many Kenyans are actually on the edge. A short break it is. I'll be back in a few. Stay tuned. Right, welcome back to Tipping Point. Yes, when I was starting the show, I mentioned that finally the healthcare providers are very important in society. It's been a tug of war between the government and health providers. Strikes you've been witnessing over the years. Actually, every year we have witnessed strike from either clinical officers, from doctors, from nurses. And right now, it's when now they are very important. So the government is trying to mobilize all its resources to make sure they are employed in every quarter of this country. But why now? Of course, it's obvious. The coronavirus has to be contained. But you see, they're taking this situation, and I can repeat again, these are knee-jerk reactions that later on it will actually come to impact the society. You see, the tax repayments, of course, have been reduced from 30% to 25%. That's another ball game over there. But still, let's talk about even the home-based care. Right now, any mild situation, as far as the COVID-19 symptoms and signs are concerned, someone can be taken care of at home. But by who? Yes, Jackie Nyaberi, you're a public health specialist. And Dr. It's something that so many are asking. Yes, I might be showing mild symptoms in the house, but who's this taking care of me? Yeah.
Oh, thank you, Nick, once again. It looks like COVID-19 is making us to just think of on how we can have a paradigm shift on how to go about containing this particular virus. I'm aware of some developed countries where home-based care is the perfect care that people are receiving, and it has been working for a long period of time. Of course, it helps in times of unflocking the hospitals with quite a big number of patients, and ensuring that the mild cases are actually taken care at home.
Yes.
Not by just anybody. And now that requires that there has to be employment has to take place for the healthcare workers, because the ones that have been employed to provide services in our healthcare facilities, they are not even adequate. And so when we are talking about home-based care, it is a concept that is gonna be very new in this country, but it is key if we are able to learn from those countries that have adopted the home-based care and how it has worked. And so number one, it will have to call for a total paradigm shift on how we are looking at, the entire building blocks of a health system, where the human resources are one of them. That if we need to ensure that home-based care worked for us, then we need to have quite a number of healthcare providers employed. We are talking about, community healthcare workers.
Yes.
We are talking about nurses. We are talking about clinicians. And then we will have to think of how are we going to map these areas, how many nurses are going to be stationed in a particular area so that they get to know how many houses are here. It even goes about how are we going to communicate so that if I'm a nurse, I'm stationed probably in my house or in a health center, which number do we call to this particular health center?
But looking at the logistics,
Yes.
the logistics and just the organizational setup we have in this country, it's actually unfortunate, very unfortunate. But you see, when you say how many nurses will be situated in this area, look at our setup in terms of how we're living. There's so many gaps, actually. Will the nurses be in hospitals or be at home? There's so much kind of a balance here.
Now, a very complicated situation. And like I said, if we had adopted this particular system right from the beginning, it would have actually been the best. I have been thinking about it over and over again because I have seen how Finland, go about it. That if you are having mild complications, they have stationed nurses. Let's give an example of a health center, or they have, particular places where the nurses or healthcare workers are stationed. And so they will use what we call telemedicine, for example, or they have systems of communicating. So if you're a nurse, you're a doctor, I'll just drop a message. I say, I live in this particular home, number this is how I am feeling, I need the help.
Structures.
So quickly what comes in is that the nurse is told, you have this kind of a patient, so they carry along all the medical products that they need for that particular patient. By the way, even the cleaning of the wounds, that patient, if they were to clean the wounds, the patient doesn't have to go to the clinic to clean the wounds. So it is like, other than, instead of me going to the hospital to work in the hospital, my work will be stationed at the community. I will be moving from one house to another, provided I am given information, or it is pointed out which house number am I going to. So I get to know I'm going to this particular house. And so if we are going to quickly adopt that particular system, which is of course very complicated, then we have a task force that needs to sit, understand the structure, the complexities that are needed for us to be able to put all the systems in place for it to work. Otherwise, if we were to adopt it, it would be the best.
Absolutely. I support that. And, Dr. Moth is one guy who has been in the healthcare system for quite some time. The proposal came out, of course, from meetings at Afya House. Let's just listen to him. He had to say something about home-based care. It's something, yes, we can achieve in the country, but as I mentioned, logistics and so many things can actually hinder that. Let's listen in.
We are developing guidelines for home-based care for COVID-19. And once we are through with the guidelines, we'll be able to quickly bring the county health management teams up to speed so that we can be able to manage mild cases at home. And so far, from the statistics that we have, majority of our cases have been mild to moderate.
Right, it starts as mild cases, but let's talk about something else. You have
that
something
would
to
be
say.
the best.
Yes.
I don't know if you've been on social media to see what is happening in some of the quarantine places that have been set. And I keep on saying, if Kenyans were to think, then I would think of, I don't think that is the place where I would like to be quarantined or isolated, because some of those places, they are not properly packaged to be able to be a setting of taking care of a patient. And so if we could quickly adopt the home-based care, I hope the task force is aware of how much is needed and the logistics to be put in place, it would be the best.
Absolutely. So, as you're aware, right now you cannot be allowed inside any premise in the country without a face mask. And when we actually had the issue of face mask coming in, we were told only medics are the ones who are supposed to wear the masks, and not so many people took it seriously. In a matatu, if you do not have one, you will be arrested and charged on the spot. Every supermarket in this country right now, you have to actually, some of them even give you gloves, and the face mask is a must. So there's a war here. Not so many people are comfortable in those face masks. The people crying about the quality of the face masks. Still something to talk about. Now, Dr. Ring, this is where you come in as a public health specialist. the issue of face masks has been a debate. Let me say a tug of war. Right now, people are even giving them for free.
Yeah.
Some are selling 50 shillings, depending on the quality, the design.
Yeah.
Some are going even fashionable with them.
Yeah.
So tell us.
Thank you, Nick, for that good question. If you go to my Facebook page, this week I have been educating people about masks.
Okay.
My quick observation was immediately we were told we are supposed to be using the mask. My quick observation was that immediately we had masks being hawked left and right on the road.
Just something to
look
cover
at
your
the
nose.
guy. Look at the guy who is hawking those masks.
Yes.
He's so dirty. This guy has been sweating all day. This guy does not even have the sanitizer. This guy has not observed the standard hygienic standards that need to be observed for him to handle. And I quickly called upon Kenyans and I said, I think this is a moment, much as we are being advocated to make use of the mask. It is very important, first of all, for you and me to think critical, like, what kind of a mask do I need?
Sure.
There is sensitization that is needed on how to use a mask, the quality of a mask that is expected for us to use. I have seen tailors now do quite a lot of businesses. If you see the masks that we have in the market, they're coming from the very old and dirty vitenges that they have been using in sewing their clothes. And then I ask Kenyans, now it is a scenario where we are supposed to prevent ourselves from this infection, but can't you use common sense and say, is this the mask that was approved? I am aware that the government is working so hard to provide the masks that are that attain the standards that are needed, and at the same time the masks that are actually affordable. Now I have advocated that if that is the way where we are going, then there is need for us to sensitize people on how to use the mask, on what kind of a mask to use, and first of all, to chase all the hawkers that are actually hawking the masks, because it is called a personal protective equipment. And if it is a personal protective equipment, then it needs to have the proper standards that it should. It needs to be clean, and we need to have properly established outlets that all of us are aware of. For example, if we talked of pharmacies or chemists, we talked of hospitals, and any other properly established outlets for the Ministry of Health, where any other person can just walk in and come out with a mask, and not just buying masks the way we buy sweets.
For the sake of buying masks, absolutely.
Yet we are providing these PPEs for purposes of wanting to protect ourselves. Then we need to use them concurrently with other measures that we have been talking about. The fact that we are advocating the use of a mask does not prevent you from washing your hands, does not prevent you from, observing the basic hygiene standards that we need to observe.
Absolutely. So let's get to something else. Yes, the quality of masks, very wanting. Someone just comes in with his or her own creative way, comes up with something that can only just cover your nose and mouth. But look at the requirements. Let's talk about standards now, because now we're talking of talks about scientists in the US coming up with stories like the COVID-19 virus can be airborne, and that caused panic all of a sudden. And that's why there was desperation just to get anything to cover your mouth. President Trump said you can use a bandana. That kind of brought the idea of you can use anything just to cover your mouth. That's why I think the masks are actually out in large numbers. But look, the airborne story is a story that made people panic. And this is why people are actually rushing for masks. And you see, when a scientist says something, it's serious. That means that this person has sat down, done his or her homework, and came up with this recommendation. But look, you as a specialist in the public health, we're so ignorant. We hear about issues of airborne kind of angle, and we still taking it for granted. People are still hugging. People are still actually just moving around together. Some actually hosting parties.
Not keeping the social distance.
Absolutely. So the ignorance angle, you talked about it last time, but it keeps on increasing, and that's why people are calling for lockdown. What do you think?
Ignorance is a killer for COVID-19. and I want to make it very clear to all the Kenyans that ignorance is gonna be a killer for, you know, for us as far as COVID-19 is concerned. It is important to be updated on proper information so that you take your personal responsibility and I take my personal responsibility.
Absolutely.
First of all, I will say that the issue of you know, COVID-19 being airborne, it's under discussion.
Yes.
But quickly, I am sure why most of the scientists are concluding that it's going to be an airborne disease is simply because there is one major issue that, I mean, aspect that is likely to qualify it to be kind of airborne. Yeah. And I responded to this last time, and I said that when you look at this, the various, you know, observations that have been made as far as, you know, sneezing and coughing is concerned, if I sneezed without a mask or without holding my, you know, my hands, and I do it in a professional way, so to say, for lack of a better word, then at the end of the day, we need to think of these droplets that came from my mouth or from my nose. Where did they land? So there is the aspect of here indirect and direct transmission as far as COVID-19 is concerned. And therefore, the reason as to why quickly scientists are somehow concluding that this is likely to be airborne for the fact that there is the direct and indirect transmission, especially when it comes to coughing and sneezing. Where do those droplets land?
Absolutely.
Some of them will land in the air for some hours, up to 8 hours, so to say. They will land in some services. I will touch the service, another person will touch the service, or this particular air that is circulating and we are not keeping the social distancing, you know, someone else will be able to receive this particular droplet. And so the idea behind the mask.
Absolutely.
So that if I put on the mask and I am sneezing and I am coughing, the droplet will not land anywhere other than inside my mask.
Okay, absolutely. All right, let me just take you through social media feedback, because so many of you are crying out, to say the least, is that the government, yes, they're giving information wisely, timely, but there's some gaps. They couldn't just do the sensible thing of announcing the cessation of these borders immediately, because some people are actually stuck outside. Let me say, someone called Luya Pound says that God has a purpose for everything, and even God knows why he brought this to us. Let's just take it positively, because now we are learning. Gavin Mungai says we are now equal. So many of us were used to going to other nations for treatment, but COVID-19 has reminded people that we are now equal. There's someone here called Victor Mosheri says that I have witnessed so much equality the last few weeks. That means that COVID-19 has made us equal, but guys, let's brace for impact. It's not actually done with us. Alex Chick says, I understand the Kenya's political engine. The hustlers are actually really going through a tough time, and let's hope COVID-19 will end soon. We go back to our normal lives. Thank you so much for our feedback. Keep on sending your feedback on SMS line 22999, and of course on Twitter you can use, that is Tipping Point KE. That's the hashtag Tipping Point KE. Of course, I'll be sampling some of them. A short break it is. When you come back, let's talk about the abrupt, sudden demand of healthcare workers, nurses, doctors. All of a sudden now they are very important in our society. Well, we're coming to you after a short break. All right, welcome back to Tipping Point. Yes, the talk is all about now healthcare workers, because all of a sudden, as I said before you took a break, they're very important to our society. I mentioned this, that they've been going on strikes year in, year out. Doctors strike, nurses strike, clinical officers strike. The other day, just a few months ago, let's say mid-2019, the clinicians were actually on strike for like 6 months. They were not paid. Some counties were not actually paid. But the good thing is now, the healthcare system in this country now is no longer devolved. The national government will be taking over the healthcare system. That's good news, meaning they'll be taken care of. But Dr. Nyaberi, it's interesting that COVID-19 is making, you know, when you talk about the balancing aspect, there's some positives and negatives also. The doctors are really benefiting here, and they're the most depressed people. The NHS in the UK, they're the most celebrated. In Kenya, the doctors are just some sort of kawaida people. But look, I'll ask you a question before, in fact, you answer anything. At some point during maybe the early 90s, 2000, I'm very sure when you recommend someone to go do medicine, he or she is assured of work, like some job somewhere at the end of the course. 6-year, 7-year course, but fruitful. But this time round, you're a medic student, but again, it becomes very difficult. But why the sudden change of tune? I understand it's COVID-19. They're becoming nicer to the medics here.
Thank you, Nick. I will twist the question the other way around. It's not even the doctors. Let's talk about the frontline healthcare workers.
Yes.
We are talking about the nurses, we are talking about the clinicians, and this is where we have been having dire shortage as far as their services are concerned.
Yes.
Because nurses and clinicians are on the forefront in terms of taking care of the patients. And surely it is unfortunate that for all the decades we have been waiting for COVID-19 to come to prompt us that now we need to see the essence and the need for us to be able to have adequate healthcare workers. As a public health specialist, and my specialization is in health systems management, I want to tell you that for sure, if there is anything that we have not given a priority in this country, is having in place a properly established healthcare system. This properly established healthcare system has building blocks that need to be put in place, that are so intertwined, that are so interconnected, that if we did away with one of them, then we don't have a balance as far as the performance of our healthcare system is concerned. One of them being the healthcare workers. We call them the human resources for health. Very important. And for any other organization, including yours, we cannot have a system that is working without having human resources in place. And some scholars said human resources are the most important assets that any organization can afford to have. And therefore we thank COVID-19 that it has made the Kenyan government to realize the essence of putting in place and to put in place the human resources. And it is not only the Kenyan government, it's now becoming a global issue as far as human resources for health are concerned. But let's talk about Kenya, where we understand our systems as far as human resources are concerned, that if we needed, at the moment, the human resources for health that we have, they are not sufficient. The ratio cannot be balanced. That's why when you go to a particular healthcare system, you will take as long as 8 hours, 7 hours, waiting to see a clinician, waiting to receive a service, so on and so forth. I am also glad that eventually, as a result of COVID-19, now we are bringing, the medical services for health back to the national government. And that is all that we needed to see right from the beginning, because in fact, immediately after we were devolved, as far as the health services were also devolved to the government, we started seeing lots of loopholes in our healthcare systems. We started coming into contact with scenarios where we are having strikes month after month. Today it will be this county, tomorrow it will be another county.
And some healthcare workers go to as much as 8 months. 8 months the whole year without being paid.
That's crazy. Then that also calls for all of us to understand the necessity of putting our priorities right, especially when it comes to putting in place a fully established healthcare system. And I am hoping that even as we we employ.
Yeah.
It's not, we are not going to stop here. We will keep on revamping the system, ensure that we have adequate healthcare services, and yet if we are going to adopt this mechanism of going the home-based care way, then again it calls for us to have more and more human resources for health.
All right.
So that's how important it is.
Absolutely. So in the US, I must tell you something is that President Donald Trump criticized the World Health Organization of actually criticizing the US of not handling the COVID-19 situation well. And his threat was he'll actually kind of just be hard on them because he won't be giving his money to WHO. WHO has distanced itself, saying that they said the truth and that's what you should learn to kind of hear the truth. But also the World Health Organization had something to say about the shortage of nurses. Let's take a listen.
Although the number of nurses globally increased by 4.7 million between 2013 and 2018, the world is facing a global shortfall of 5.9 million nurses, especially in Africa, Southeast Asia, the Eastern Mediterranean, and some parts of Latin America. We're calling on countries with shortages of nurses to increase the number of nurses they graduate by an average of 8% each year, and to implement measures to improve the employment and retention of nurses in the health system.
All right, that was the talk from the World Health Organization, meaning nurses are very important in the healthcare system. But let's now move on to something else. The extension of quarantine, and not so many people have actually been impressed by this. And according to the medics and of course MOH, Ministry of Health in the country, they said that those in quarantine, some of them mingled together and they reinfected each other again. Some were negative, some were positive. But again, this is what happened. On Tuesday, you're tested, you're negative. But come on Thursday or Friday, you're positive. So they figured it out that most of these guys in quarantine areas are actually mingling. Some of them meeting for lunch, dinner. And that's why 14 days again was given for the guys who are yet to finish their term and go home to their families. But again, they started 14-day mandatory quarantine. So this is something very, very unfortunate because 14 days already in a hotel is already depressing. What do you think about the measure?
The measure is okay. First of all, it's a scenario where you just need to have a taste of the consequences of the things that you did.
Yeah.
Because at the point in time that individuals are being quarantined, they are given clear rules and regulations. They are told the do's and the don'ts while you're in this particular site. They're made to understand that the fact that you're here and all of you have come from all over, some of them could be positive, some could be negative.
Yeah.
So a scenario where people do not obey, a scenario where people decide to become ignorant, those are the end result of the same.
Yeah.
And therefore, it's all about ensuring that if we were to obey, if you were not to be ignorant and stick to what you're supposed to do, then the right thing would have been done. And I think that sends a message to all Kenyans. It is not only those in the quarantine sites. It is talking to all of us. Every day we are being given briefs of the do's and the don'ts. We are being reminded of what we should do, what we should not do. We need to keep social distancing. We need to observe hygiene and sanitation. We need to wash our hands. We now need to use the mask, like you rightly put it. In most of the places where you go, you will not just go into the supermarkets. And I'm happy that most of our supermarkets have actually now made it mandatory that for you to go in, you must be able to have a mask.
Sure.
For Kenyans to be able to see the sense of being obedient as quickly as possible. And surely if we are all going to obey, then it's going to take a short period of time for us to be able to contain this and to bring this to an end. And Nick, I want to put more emphasis for Kenyans to see the need of, being obedient. Let's look at the numbers of the individuals that have been tested, and especially those that have come positive, those that have gone to the hospital, and how many have come out as healed. Now that reminds us of how long it is going to take you and me to be in the hospital for the virus to be cleared. you know,
Yeah.
because you will have to be tested about 3 times for them to have reconfirmatory, you know, tests to be able to have clear indication that now you do not have the virus, now you're free to go home. It is bitter. And therefore, the need for us to ensure that we do what is right. The need for us to ensure that even in your quarantine sites, even in the homestay, which we are so much encouraged to stay at home, can you do what is right? So that you protect yourself within that particular vicinity.
Yeah.
You protect other persons within the vicinity where you are, the interactions that you are having with the people, and it will be easy.
Okay,
Yeah,
okay.
yeah.
So many people have been complaining, yes, as I mentioned earlier, about what is happening in the quarantine areas, and the extension already is already depressing. But let's listen into a plea of someone actually who's going through that.
The thing is, we have already tested negative for this. It's not our fault that people who didn't self-isolate when they were asked to, that we bear the consequences of all of this. It's taking a toll on our mental health. If we wouldn't be affected by the virus, for sure we will get so many panic attacks. I have had 4 panic attacks in the last 2 hours, and this is not done. We find out that we are going to be quarantined for 14 more days. That's not all. The hotel staff has not been tested. After the 2 positive cases, it makes just a lot of sense to have the hotel staff tested. We don't know how safe we are over here. We surely expect that we would be much more safer in our own houses because we're not meeting so many people. That's one thing. And other than that, the government has not taken into consideration the mental health of all the people quarantined. It's not our fault. We are paying for this. It's like you're robbing off your citizens to fill pockets that are already full. Because if this was at all about our health and our safety and the nation's safety, you will not have dragged us from the airports in overcrowded buses. And the way we were treated in those buses, I don't even have words to speak about that. We have not had our clothes washed for the past 14 days, and now it's going to happen for the next.
Wow. That's actually very unfortunate. And with such situations, it means that another 14 days they have to dig deep into their pockets to sort out their accommodation in those hotels. Some are very expensive. Maximum of 12,000 a day is no joke for some Kenyans out here. But look, Waswahili walisema mtego wa panya actually wapata wasiomu na waliokuwemo. She's crying about that whole scenario of some people who defied the orders to stay indoors, and some actually mingled together, and some of them, they were very obedient, but it's actually caught up with them. It's unfortunate, yes, but look at the expense part.
Yeah, it's unfortunate, and I really pity them all. Yeah. But again, from the perspective of the clinicians or from the healthcare workers, they are not going to assume. They are not going to assume. I agree that really in terms of the pockets of the individuals that have been affected, it's quite a very difficult situation, not only in terms of their pockets, but mentally, you know, so on and so forth. But then it's also important for them to understand that now they need to play their role. They need to be their brother's keeper.
Yes.
Like, why would I want to mingle with you yet you do not know my, you do not know my status.
Yeah.
I do not know your status.
Sure.
Why would you see Nick and Jack doing that and you cannot be able to tell them, because it's going to affect all of you? Why?
Yeah.
It is because you are in the same particular area where all of you are contained.
Yeah.
And therefore the assumption is that the fact that one is positive or 2 are positive, there is a likelihood that within 2, 3 or even 4, 5 days we're gonna have more cases. So it's the right thing for the healthcare workers to have done, or the Ministry of Healthcare Workers to have done. But then I don't know if I was in a position to help, I would have probably gone ahead to say, can we be in a position to waive you know, them a little of the cost, so that at the end of the day, really, we don't make sure that the consequences are felt by everybody, including those who obeyed.
Yeah. So, and also to support that is that the government noticed that most of the infections actually came from the quarantine areas, and that's why they're not taking any chances of guys leaving the hotels or where you're isolated.
Sure.
Yeah, but as you're finalizing this, there's that mental setup. For her, she's mentioned something that she's been affected because now enclosed in one room, I think you need someone to talk to for quite some time. And in some religious aspects in our culture, like for her, she's not supposed to mingle with even some people. She doesn't know. Some people she don't used to be. It's catastrophic for her mind.
Yeah.
Do you think now, after quarantine, the people will need help and therapists and counselors should be out here on standby?
It's a situation that is really jeopardizing, and I will talk not only for those who are in quarantine, but even what is going on in the country at the moment.
Yes.
As far as mental health issues are concerned, now it's an area that is really largely affected, and this is owing to the fact that you being a social being, you're being contained in one particular area, in one particular, for example, environment, and therefore it also calls for individuals to look at situations that can work for them at that point in time. And I wish this information or message would go to all of us.
Okay.
Because you may sometimes not even realize that you have been mentally or, health-wise, you have actually been affected. So it calls for all of us in whichever places where we are, whether you are restricted to be in Nairobi or you're restricted to be in Mombasa, or you're quarantined in the place where you are. I am sure they're not just put in a room like this and you're told to stay there 24 hours. They have been given an area where they can even, you can take a walk. Do one or two things that can actually keep you.
That's risky. That's risky again, because you'll tend to meet someone out there.
But there is the aspect of social distancing, Nick. There is the aspect of social distancing.
Not everyone actually kind of.
No. We are now talking about an environment where we are confined, and we are probably having a particular field that is quite large, and so it's obvious that not all of us will walk out of our rooms at the same time.
All right.
So looking at what can be able to work within our context, that could be very good. And I want to remind all the Kenyans that now we are in situations that are really insurmountable as far as this COVID-19 is concerned. Let us not set ourselves to face the poignant effects of what COVID-19 has. Let's do what we can be able to do within the context where we are. Do one or two things that can support you and get better, get out of that place. Take care of your health,
Absolutely.
in a holistic manner.
Okay. Thank you so much, Jackie Nyamberi, for actually coming to studio today. And let me just sample some of your tweets. And of course, the hashtag that has been trending is we stand with Kenyans. And Igwe Levy says, after they made it fast for the coronavirus to get into our country fast, stand with whistleblowers like Ali Gary, who was sacrificed for cautioning the nation. Unlike Twitter generated problems, patriotism, Gary is a patriot from the soul. Now, Nicholas Trump Oseko says, let Kenyan newspapers and mainstream media contribute to actually help people suffering from coronavirus instead of giving us headlines that are actually in sync. Of course, if you realize this morning, we had headlines about we stand with Kenyans from all the main dailies here in the country. And there's something else here. Ruben Ewoton says, a sneeze from a place as far away as Wuhan, China, can make a favorite hospital bed in London unavailable. Wow, that's actually very powerful. But again, let's not try and stigmatize all this thing about Wuhan virus, China virus. But thank you so much for tuning in tonight on Tipping Point. I really appreciate your feedback and, of course, SMS lines and Twitter. But there's one thing that needs to, like Kenyans need to understand, is that minimize meeting people, minimize going for visits. I mean, just stay at home. It won't be easy, yes, But that's the only solution we have now, to stay at home and minimize missing people. Yes, you might see some quarters of the Republic business as usual, but they are ignorant. They don't know that this thing is actually wreaking havoc in other parts or even stronger economies like the US, Britain, Italy, and Spain. Stay safe, sanitize, wash your hands, and of course, we'll again be talking as healthy people in 4-5 months, maybe to come. My name is Nick Mudimba. Have yourself a good night, and of course, on behalf of Dr. Jackie Nyaberi, I must say I'll see you again next Thursday right here on Tipping Point. Be safe.